One fairly frequent cause of low back pain is called sacroiliac joint dysfunction, or SI joint dysfunction. The sacroiliac joint is where your spine comes into your pelvis. It is a joint that moves, but just a couple degrees. It can become dysfunctional, either through arthritis or from falls or trauma, and it can cause a significant amount of low back pain. Some estimate 20% of low back pain is from SI joint dysfunction. The treatment of SI joint has always been very difficult. There are some newer techniques which are minimally invasive to fuse the joint if we think that's the problem. We offer this minimally invasive fusion technique. It's basically a procedure done under X-ray where an implanted device, actually 3 of them are passed across the joint to provide stabilization so the joint does not slip and move, as that's the problem, is that the joint becomes loose and moves and causes pain. So that it's typically either an outpatient or overnight stay. We can place these devices across the joint to fuse it into position so that when weight-bearing movement does not cause the pain. The advantage of this procedure is it's approximately 1-inch incision. It takes about an hour to do. It's done in the operating room, of course, but most patients are limited weight bearing for a couple of weeks but are discharged from the hospital the same day or the day after. Once they heal up, which can take about approximately 6 weeks completely, they have no restrictions. There's not any loss of motion, as the SI joint typically moves just very little, so the patients will not notice any loss of motion, and hopefully they'll have significant pain improvement and improvement in their lifestyle. But there are no limitations after they've healed up.